Hi, I'm Dr. Tieche with our MedMinute question for the week. So this week's question is a super common question we get. What are the main differences between Botox and Dysport, and why would we pick one over another? So really, to go back a step, those are both chemicals that are called neuromodulators. And what they do is they regulate the nerve junction between the nerve and the muscle. So they soften muscular contraction. So big fancy thing, but what does it do? Well, we use it in aesthetics to soften muscles on our face. And basically, so it helps get rid of wrinkles because the wrinkles are from muscles contracting a lot. So the common areas that we treat are the glabella, the forehead, smile lines, and sometimes we'll do things like lip flip and a brow raise. So both of them work for that. Botox was the first to market. So in other words, it was been around a lot longer. It has the most brand recognition. It's almost like Coke. Anytime you just go say, I want a soda, people say, I want a Coke. Same thing with people that say Botox. I want Botox. And when you ask them, do you really want Botox? They really don't know. That's just what they know, that term. So Botox and Dysport, there's several others, are neuromodulators. They soften the muscles. They have a couple of main differences. One is the molecule size of the compound. So Botox has a large molecule size. Dysport has a small molecule size. So when we're treating areas, we end up using about 3 times the amount of Dysport for every Botox molecule. Now, that sounds like, oh my God, it's going to be so much more expensive. No, the reality is Dysport at each molecule level or each unit is 1/3 the price. So it cost-wise to treat an area ends up being exactly the same. It's just for us to use that when we're measuring it. So what is it? That means Botox tends to stay a little bit more focused in one area. It's a little bit more precise because of the larger molecule size. They both tend to start working almost immediately or within a day or two and peak really about 7 to 10 days. In my experience, I feel like Dysport works a little bit quicker. So people start to notice the improvement a little bit quicker, and it seems to last a little bit longer. But that's kind of a difference of opinion. If you read it, it says they're about the same, but that's not been my personal experience of treating lots and lots of people. So other than that, they are used to treat the same areas. And so it really ends up being, after a while, which do you choose? Well, there tends to be a little bit more with time of antibodies being generated to some of the particles that are in the Botox solution. So what that happens with time is people feel like their Botox doesn't last as long. So in other words, I had my Botox, it seems like it wears off quicker. Well, what happens is your body sort of attacks the molecules and metabolizes them a little bit quicker. So there is some truth in that. Dysport, there's a little bit less of that. If we really are having a problem, we could do something totally different like Xeomin, which doesn't have any particles that stimulate antibodies. So they both can do it. There seems to be a little bit more with Botox. Sometimes people will alternate. They'll use Botox for a while and then feel like they want to switch it up and switch to Dysport and go back and forth that way. Both work fine. Really, I'm drinking Coke or I'm drinking Pepsi today. They both are in the same group. Some people just have a preference. They like one over the other and say, this is just the one I want. And so it ends up being that way. My personal preference is I do like Dysport a little bit better than Botox. I feel like it's much more consistent and predictable, but they both work fine. I'm not going to say that Botox does not work. So again, people, when they're getting treatments of those areas, everyone wants them to work as quickly as possible. They do start to work immediately, but again, it's generally the 7 to 10 days when it's at its peak. That's when we usually recheck people to see if they need some additional treatment. And they both last about the same amount of time, anywhere from the long end of 3 months to 5 or 6 months. And that's very variable. That's based on people's activity levels. So people who exercise more, they tend to wear off a little bit more, but also exercising those muscles more. The other thing is the amount that we put in. Some people want a soft treatment. They just want things softened. They don't want to be what we call frozen with no movement. That's going to wear off a little bit quicker because it's just not as much molecules there. So that takes a role in how long this product lasts. Or always can't compare, say, well, this one lasts longer than that. It's really based on dose too. Oh, I put $1 worth of gas in my car or I filled the tank. Well, the dollar didn't last as long because it just was not as much product in there. So that's a big thing that we have to do when we're comparing apples to oranges or Dysport to Botox. So really, they both work the same amount of time. They both last the same amount of time, just maybe what we'd say anecdotally, the Dysport works a little bit quicker and lasts a little bit longer. It ends up being personal preference. They both work well for treating those areas. And it's a commonly used medication for that, for softening those smile lines, softening the frown lines and things like that. So any other questions about Botox or Dysport, please submit that. And any other questions for your Med Minute, please submit below. Thank you.